We know time is muscle. Here's an interesting way to make things go faster. Crush that Prasugrel. In the May 3rd issue of JACC, crushed Prasugrel in patients with STEMI undergoing PCI. It is the CRUSH study. And to talk about it, I'm with Dominick Angiolillo, who is an MD and PhD, and he is a professor of medicine and director of cardiovascular research at the University of Florida College of Medicine in Jacksonville. What was it that triggered the idea for the CRUSH study?
Well, there were several ideas that led to the design of the study. We've learned over the course of the past several years, conducting a series of pharmacodynamic studies, that although the newer P2Y12 inhibitors act more promptly in the vast majority of patients, it doesn't seem to be the case in patients with ST elevation myocardial infarction. There's a time delay in the onset of the effects, and we know that time is muscle, and therefore efforts to accelerate the effects of the drugs are clearly needed. And along this pathway of investigations, there was one seminal study by our colleagues in Italy and Greece called the Mojito study, which actually crushed the tablets, in that specific case, ticagrelor, and did show that there was an enhanced platelet inhibitory effect at 2 hours after giving the drug compared with the whole tablets. So we wanted to expand upon these findings, and we said to ourselves, well, what are the missing pieces of the puzzle? Well, the CRUSH study expands in three ways. One, we looked at a new drug, at a different drug, in this case Prasugrel. Two, we conducted a more comprehensive pharmacodynamic study by adding more time points and more pharmacodynamic assays, just to provide confirmatory results. And three, we wanted to have some mechanistic insights, and to do so, we wanted to look at pharmacokinetic assessments to really understand if this was attributed to a difference in drug absorption and metabolism.
So specifically, what did you do and what did you find?
Well, we essentially analyzed or randomized 52 patients, so it's a relatively small study, but it's a very detailed PK/PD study. And these patients were randomized in a one-to-one fashion to either crushing the pills or taking the standard whole tablets of 60 milligrams of Prasugrel, in other words, 6 10-milligram pills. And we did a series of assessments at 7 time points using 2 different pharmacodynamic assays and pharmacokinetic assessments. So a lot of work, a lot of sleepless nights to conduct these assessments, and found that there were differences in the pharmacodynamic effects already at 30 minutes. Persisted at 1 hour, 2 hours, 4 hours. It was only after 6 hours that the two curves of the 2 treatment arms actually emerged.
Mojito, it was a little slower, right? They didn't find it quite at 30 minutes.
It was not.
It was not as quick.
It was not exactly. It was not as quick, but it's also true that it showed a difference. But out of fairness, it's important to say that they were different studies with different drugs, with also some different type of assessments and timing of administration, et cetera, et cetera. So we found it very encouraging, because we found a quick and cheap way to accelerate platelet inhibition, because essentially you're taking the same exact drug at the same exact dose, just giving it in a different formulation.
I mean, obviously intravenous cangrelor is an option too, based on a pooled analysis from the 3 champion trials, but of course there, cost would be an issue.
Obviously, when you're adding drugs, there's an added cost, particularly when you have an intravenous agent. Now, having said that, it's important to note that crushing your oral tablets does not trump the effects of an immediate acting intravenous agent, but having an oral agent that kicks in quicker is always welcome.
Now, in the accompanying editorial comment to your paper, the writers put it, the rate of stent thrombosis in the first 24 hours is still pretty significant for many places, and so anything you can do to speed up the process and protect these patients has to be a good thing.
Absolutely. Absolutely, and crushing is the way. And it's really simple. There's also some other comments from others that I've heard. Well, it's complicated to crush the tablets. We use a syringe crusher, and the proximate time to prepare the crushed sample was around 2, max 3 minutes. So it's very, very simple. There's a syringe crusher, you put in the 6 tablets, you crush them, it turns into a powder in a matter of a couple of twists of the syringe crusher. Take some water, shake it, put it in a cup, there's some residual, take some more water to rinse it, put it in a cup, drink, and it's done.
Wow, that's pretty fast. So are you using this now?
Systematically. There's no reason not to crush, in my opinion.
Right. Well, even the editorial comment said, go faster and no fear to crush.
Absolutely.
I thought that was terrific. So it's the CRUSH trial, and the study is published in the May 3rd issue of JACC. Please check on that. For Cardiosource World News, I'm Executive Editor Rick McGuire.